I'm Dr. Dan talking to you from Vitamin Pro, and today's topic, antioxidants, and especially for the gluten intolerant. Now, if you've been eating gluten most of your life, like just about everybody, you're going to find that it's going to cause some inflammation, and how that attacks your body depends on the person. And in order to heal up from that, of course, going on a gluten-free diet is essential, but there are certain supplements that are going to speed up the healing process, and some of those are antioxidants. We'll talk about this in this video. Next video we'll discuss other important supplements. So antioxidants are important because normal physiological processes, and especially if you have inflammation, you're going to produce these oxidative compounds. And certain other compounds like vitamin C, vitamin E, CoQ10, glutathione have the ability to actually attach themselves to those oxidative compounds and neutralize them so that they don't go through your cell and cause damage. And because gluten intolerant people have some level of intestinal involvement usually, and it could be very subtle, that can only be picked up on a scanning like a microscope, or it could be real pronounced, that with really frank symptoms. But it's difficult with that kind of intestinal problem to absorb the proper antioxidants. So we need to supplement these, and especially through the healing process. Now, vitamin C, vitamin E have been around for a long time, and they're really cheap and really easy to supplement. So we recommend 500 to 1,000 milligrams of vitamin C a day, just because, and also vitamin E, maybe 400 to 800 IUs. And that should be at a level good enough to kind of force the issue to get those antioxidants into your cells so that they can process these oxidative processes better. Now, the other antioxidant we'll discuss is a Coenzyme Q10. Been a lot of research done on that over the last 50 or 60 years, and what they find is that people who take CoQ10 do have they age better. They just don't have the same types of problems that people who are low on CoQ10. Now, it used to be that 25 or 30 milligrams was enough. Now it's been recommended to take 100 to 200 a day. And we've been using Karuna CoQ10 for many years with excellent results. Now, another antioxidant you may not know about is glutathione. Now, glutathione is probably the most important of them all because it helps activate the CoQ10, vitamin C, and vitamin E. Now, the glutathione is the indicator, the most important indicator for us to be able to tell what your disease resistance is and how long you're likely to live. People with low glutathione levels tend to be more susceptible to all kinds of disease, and they don't live as long. So people who tend to maintain high glutathione levels throughout their life tend to be far more disease resistant and live longer. Now, 3 ways of getting that glutathione. One is thorn glutathione, which is a type that your body can assimilate and use in a pill form. And another is Apex Oxycell, which has a cream base, so that goes in through your skin. And that also comes with the superoxide dismutase, which helps accentuate that glutathione reaction. Now, another more novel way are the LifeWave glutathione patches. And those are energetic. You stick one on your below your belly button, works for about 18 hours, and the effects actually last for a couple of days. So, we have all those in our O-Vitamin store, and if you really want to make sure you're getting enough glutathione, you could try a couple of those. Now, the other one I mentioned was Carnosine. Now, Carnosine is not really found in the bloodstream, but it is a major component of antioxidation in muscles and brain tissue. And the only way that I know of getting your Carnosine levels built up is by using Carnosine patches, again by LifeWave. So if you're gluten intolerant, you're going to want to be taking some supplementation in order to increase your probability of healing. And so antioxidants, of course, are absolutely key, foundation for all that. So those are my recommendations. So thank you a lot for listening, and I hope that was helpful for you.